Today is World Diabetes Day. It is the day that we remember people living with diabetes and the challenges they face, and also it's a day that will bring the attention of leaders and policymakers about diabetes. This year's theme is diabetes and well-being. It focuses on the well-being of the people living with diabetes. The sub-themes are diabetes and the workplace, and also nutrition as a diabetes medicine. Almost 600 million people are living with diabetes worldwide. 1 in 9 people are living with diabetes. But the alarming thing is that 81% of people living with diabetes are living in developing countries such as Nigeria. It is important that people living in developing countries join hands together to prevent and treat diabetes. When you talk about diabetes and the workplace, it focuses on the things that employers need to do to ensure that the workplace is very conducive for people living with diabetes, ensuring that testing of blood glucose is done in the workplace and the basic emergency treatment needed for diabetic patients is available before onward referral to hospitals. It is also important that the workplace provide necessary information for people living with diabetes to manage the diabetes, and also people trying to prevent themselves from developing diabetes have the needed information they need. It is also important that in meetings and gatherings, options are available in terms of food for diabetic patients. Nutrition is regarded as diabetes medicine because nutrition is very essential for both prevention and treatment of diabetes. It is important that whosoever wants to prevent and treat diabetes stop all simple or refined sugars, reduce saturated fat, eat whole food rather than processed food, eat small with a lot of vegetables. That way you can fix your blood sugar if you're diabetic, or if you're not diabetic, you can prevent yourself from developing diabetes. So it is important that on this day, if you're not diabetic, reach out to people living with diabetes and render a helping hand.